So when you're preparing for one of those, highly specialized professional roles.
The ones that blend everything.
Exactly. You've got complex science, you have really sensitive ethics, and this deep personal care component.
Like being a holistic health practitioner.
Right. And the real challenge there, it isn't just about knowing your field. It's about knowing how to articulate all of that across so many different situations.
Being able to prove it.
Yeah. Proving you're ready for the technical query, the ethical dilemma, and can tell a good story about your past successes.
It's a lot to juggle.
It is. But today, we are absolutely going to shortcut that whole prep process. We're diving into a single, really authoritative source.
We found a fantastic guide.
We did. It's an interview preparation guide. It's called Top 31 Holistic Health Practitioner Interview Questions and Answers. And it's the updated 2025 version.
Right, written by Andre Mendez. I think it was published back on March 30th of this year.
That's the one. And our mission today is, well, it's a bit more focused than just reading through a list of questions.
For sure. We're going to analyze the structure of this resource.
Because by looking at how Mendez organized everything,
you get this immediate, really powerful insight into what employers are fundamentally looking for and maybe what they're afraid of in a new hire.
And the guide says as much. It states right up front that these tips are designed to help you, the candidate.
Whether you're a seasoned pro or just starting out.
Right. To confidently showcase your holistic expertise and stand out. And that phrase, stand out, that's our key metric for success today.
And just the fact that there are 31 questions, all organized.
Yeah.
It tells you right away, this isn't just a casual chat.
No.
It's a rigorous, multifaceted exam. It's a blueprint, really.
Yeah.
And the first big insight is right there in the table of contents.
Yes, that's where it gets interesting immediately. The questions aren't just a random list. They're grouped into 3 very distinct, non-overlapping buckets.
3 buckets of professional competency.
Okay, so let's unpack this blueprint.
Let's do it. The categories are explicit. You have situational questions, behavioral questions, and technical questions.
And that structure, it just reveals so much.
It does. It shows that an employer isn't just grading your knowledge. They're screening for 3 different kinds of professional intelligence that all have to work together.
Okay, let's start with the first pillar then. The one that I think makes most people a little nervous.
Situational questions.
Situational interview questions. So what does it mean when there's a whole category just for hypotheticals, the what if questions?
It means the employer is trying to stress test you.
Stress test what exactly?
Your ethical agility, your immediate problem-solving skills. Situational questions are all about seeing how you think when the pressure's on and the answer isn't in a textbook.
It forces you to turn your philosophy into an actual action plan right there on the spot.
And in the holistic field, that's so important.
It really is. I mean, in conventional medicine, protocols can be pretty rigid. But in holistic practice, you're dealing with integration, client autonomy, modalities that are sometimes
outside the mainstream. The lines can get a little fuzzy.
Exactly. The ethical lines are fuzzier.
And that's what these hypotheticals target. They often center on these really complex ethical boundaries that require you to make a judgment call, and fast.
Can you give us an example?
Sure. An employer might ask something like, a client insists on taking a high-dose herbal remedy. You know it conflicts dangerously with the prescription they mentioned, but they refuse to talk to their doctor. What do you do?
Wow. Okay.
Yeah. How do you draw the line between empowering your client and ensuring their safety?
That's a high-stakes scenario. And they're not looking for you to just recite a list of contraindications.
Not at all.
They're listening for your applied ethical compass. Do you default to the regulations, or do you prioritize what the client wants? And how do you communicate that boundary?
That's the core of it. Another classic one is about scope of practice. What steps do you take when a client's symptoms suggest something serious, like cancer, that's completely outside your scope to diagnose?
So they're testing your immediate response. Do you know the legal and ethical limits of your own role, and will you respect them instantly?
Precisely. The situational questions are all about that strategic response and immediate client care under pressure.
So it doesn't really matter what you say your ethics are. It's about what you would actually do when the heat is on.
But that raises a good point. If a candidate just nails the situational ethics, gives a perfect textbook response to that supplement conflict.
Right.
Does that just prove they're good at theory? It doesn't tell us if that's how they operate day to day.
That's a critical point, and you've just hit on the exact reason why the interview then pivots sharply.
It has to
the second pillar, behavioral interview questions.
Exactly. While situational questions are forward-looking, testing how you will act. Behavioral questions look backward.
Tell me about a time when.
Yes, that's the classic opening. This category asks for real-world examples to test the consistency of your professional behavior, your actual track record.
So past performance is the best predictor of future behavior. The source has a whole category for this, which means the employer needs structured proof, not just promises.
Absolutely. They'll ask things like, tell me about a time you had a communication breakdown with another healthcare professional. How did you resolve it? Or describe a complex case where your treatment plan failed, and how did you adapt and communicate that failure to your client?
You know, it strikes me that the behavioral questions are maybe the hardest.
How so?
Because they demand structured storytelling. It's not just recalling a fact.
Yeah.
And the source mentions it provides example answers, which tells me the structure of your answer is just as important as the content itself.
It is. You're basically talking about the STAR method.
Right. Describing the challenge, the action you took, and the result.
And that structure is so vital, especially in the HHP world, where challenges are often about emotional client relationships or unexpected physical reactions. The employer is listening for your critical thinking process, not just the happy ending.
Okay, but what about a newer practitioner, someone who hasn't built up this, long track record of professional stories to tell? That seems like it could be a major roadblock.
That's a great question, and the guide sort of implicitly prepares you for it. For new practitioners, the focus just shifts to transferable experiences.
So from internships or something?
Exactly. The goal is the same. Show that you consistently apply ethics, empathy, and professional growth. So a new practitioner might talk about a clinical internship, a mentorship experience, or even a tough situation from a job outside of healthcare.
As long as they frame it correctly?
As long as they can frame the challenge, the action, and the result in a way that showcases those core competencies: communication, adaptability, ethical judgment.
So it proves they don't just know the answers, they've actually applied them consistently, whether that was 3 years ago or 3 weeks ago in a clinical setting.
Right. So if situational tests your judgment in a vacuum, behavioral validates your professional character in the real world.
Which brings us to the third and final category. This one feels a bit more straightforward, but it's the foundation for everything else.
The technical interview questions.
This is where the rubber meets the road on your actual knowledge, isn't it?
This is your entry ticket. If you can't pass this part, nothing else matters. This is the check to make sure you have the professional terminology, the core theory, and the practical know-how.
So what does that look like in this field specifically? What kind of technical depth are we talking about here?
It's very integrated knowledge.
Yeah.
For example, a technical question here might test your understanding of how different systems work together. Compare and contrast the diagnostic philosophies of Ayurveda and traditional Chinese medicine. Or something very specific like, explain the contraindications for high-dose vitamin C therapy in a patient with kidney stones.
That's a key difference, right? It's not just about naming a modality. It's about knowing its mechanisms, its interactions, its safety boundaries.
Exactly. The employer has to verify that you can operate legally and safely. They might even ask about the less exciting stuff.
Like regulations.
Yep. Describe the legal requirements for charting and HIPAA compliance in a multidisciplinary wellness center. The dry, but absolutely necessary technical details.
So technical mastery is crucial. But the fact that those other two categories even exist proves that knowing the textbook isn't enough.
Not by a long shot. You can memorize every technique in the book, but without consistent application, your behavioral proof, and the ability to pivot under pressure, your situational agility, you won't pass this three-part screening.
So what does this all mean for you, the listener, who's trying to land this kind of role? If the goal is to confidently showcase your holistic expertise and stand out, how do these three question types actually define that expertise?
Well, we can connect the dots now, and it becomes a really powerful model. True holistic expertise, at least according to this guide's structure, means you can seamlessly demonstrate a blended skill set.
It's all three at once.
It's all three. It's the technical competence, your foundational knowledge, paired with a consistent application of care and ethics, which is your behavioral evidence, and then critically, the ability to strategically manage new challenges, which is what the situational questions get at.
And that insight really changes how you should prepare. Mendes says preparation is key, but it's not about just reading, it's active preparation.
Right. You have to develop and practice structured responses for all three categories. You can't just cram for the technical part and hope to wing the other two.
It's almost like preparing for 3 different interviews at the same time.
In a way, yes. And you can see that urgency in how the guide is presented. The fact that it's available as a PDF for offline study and interview preparation.
It's telling you to take this seriously, to practice.
Practice across all three dimensions.
But looking at the table of contents, this is where it gets really interesting for me. The very last entry, totally separate from the 31 questions, is a section called Holistic Health Practitioner Position Details.
Yes.
Why would a general guide include that?
That is the most fascinating clue in the whole document. It reveals the final layer of preparation you need if you really want to stand out.
So the top 31 questions are just the building blocks.
They're the generic building blocks of competence. But including position details suggests those generic answers aren't enough on their own.
I think I see where you're going with this. It means you have to be able to connect your general expertise, your 31 core answers, to the specific needs of the place you're interviewing at.
It's exactly right. Think about the difference between applying to a small, private, cash-pay chiropractic office versus a huge, integrated hospital wellness center.
Totally different worlds.
Totally. So if a behavioral question asks you about resolving a conflict with a coworker, your answer needs to reflect that specific environment.
So the small practice might value direct communication and autonomy.
Right. Whereas the big hospital system will demand you follow institutional hierarchy and formal protocols. Your answer has to show you understand their world.
So if you've done your homework on those position details, what they emphasize, who their patients are, how they're structured, you can tailor your answers.
You can make your general answers perfectly, specifically relevant to them. And that is the difference between being just another competent candidate
and being the perfect fit.
It's about operationalizing your research. It means you understand their specific legal scope, their integrated environment, their unique ethical challenges, and you adjust your pre-prepared stories accordingly. That's how you get hired.
Okay, so let's bring this all back to you, the listener. This framework, situational, behavioral, and technical, it's useful way beyond just an HHP interview.
Oh, absolutely. It's a powerful tool.
It's a way to structure your own self-assessment for any complex professional job screening. If you can map your skills against those three dimensions, you're already way ahead of the game.
And that just underscores the central idea from Andre Mendez. He calls the process challenging and says preparation is what gets you through.
But it's a specific kind of preparation.
It is. Success isn't just hoping you get asked the questions you studied for. Success comes from intentionally preparing for all three dimensions of competence and then layering on that context from the position details to make it all hit home.
So rote memorization of technical facts is just the entry fee.
It's the entry fee. But situational and behavioral mastery, backed by that tailored context, that's the key that unlocks the door.
So to recap everything, our deep dive into this HHP interview blueprint shows that being truly ready for the role demands preparation across three distinct axes.
You've got your situational readiness,
which is your ethical and strategic agility.
Then your behavioral consistency,
your proven, structured track record.
And finally, your technical mastery,
your essential foundational knowledge base. You need all three.
Which leaves us with a really important question for you to think about on your own.
Okay.
When you're interviewing for any complex, integrated role, which of those three categories, situational, behavioral, or technical, is actually the most difficult to genuinely master, and why?
That's a great question.
Think about it. How hard is it to fake consistency over time, which is behavioral, versus inventing good ethical judgment on the spot, which is situational? How would you weight those three areas in your own professional preparation from now on?
Something critical to mull over. Thanks for joining us for this deep dive.